To be co-presenting with our Aspen security colleagues this next session, Defeating the Virus, the Biden administration's global vaccination pledge. As you all surely know and appreciate, the world is facing many borderless threats, including climate change and a global pandemic. In the interconnected times in which we live, public health and safety are rightly viewed as a national security issue. The Biden administration has pledged to share 1.1 billion COVID-19 vaccine doses with the world, with the goal of vaccinating 70% of the global population within the next year. So far, the U.S. has delivered 200 million of those doses. Of the more than 6.5 billion doses administered globally to date, fewer than 4% have gone into the arms of people in low-income countries. Clearly, much work remains to be done. How can the U.S. and its allies come together to execute, in effect, a vaccine Marshall Plan? That is the question this outstanding next panel of speakers will address, and let me now briefly introduce you to them. Gary Edson is president of the COVID Collaborative, a national assembly that has united leading experts and institutions across the health, education, and economy sectors to combat the epidemic. Previously, Gary served as Deputy National Security Advisor and Deputy National Economic Advisor to President George W. Bush. Kathleen Sebelius is CEO of Sebelius Resources, where she provides strategic advice to companies, investors, and nonprofit organizations. Kathleen served as Secretary of Health and Human Services under President Obama and as Governor of Kansas. I'm very proud to add that Kathleen currently chairs Health Medicine Society's Aspen Health Strategy Group, whose mission is to promote improvements in policies and practice by providing leadership on important and complex health issues. Gayle Smith is Coordinator for Global COVID Response and Health Security at the Department of State. She is on leave from the One campaign, where she has served as President and CEO. Prior to the One campaign, Gayle was the administrator of USAID. She also served with the National Security Council during the Obama administration, where she helped lead the U.S. and global response to the Ebola crisis in both 2014 and 2015. Ann Pritchett is Senior Vice President, Policy and Research at PhRMA. In this role, Ann oversees the development of legislative and policy analysis and research studies on a range of issues impacting innovative biopharmaceutical companies, including intellectual property and FDA policy. And finally, our moderator for today's session, Kavita Patel. Kavita is a primary care physician and non-resident fellow at the Brookings Institution, where she previously served as managing director of the clinical transformation at Brookings Center for Health Policy. She also served in the Obama administration as Director of Policy for the Office of Intergovernmental Affairs and Public Engagement in the White House. Thank you all for joining us. Great to have you here for certainly this most very timely session and for what promises to be a very rich and thoughtful discussion. Kavita? I'm behind you, I know. Kavita's right behind me, front and center now. The Aspen stage is all yours. Thank you all for being here.
Thanks so much. Thank you very much, and I know that we've got incredible agenda packed for the next 42 minutes, and we'll try to fit it in. I just want to say for Coordinator Smith, she might have to exit stage left. She, like all public servants, has someone she needs to make sure she is present for a staff meeting. So she might leave a little early, but we couldn't ask for a more esteemed panel. We're going to do a very quick, just kind of lightning round across the panel. I'll actually start with Gayle, if that's okay, so that we can come then back to me with setting the stage. Ruth, thank you for laying down, I think, what is incredibly time sensitive, but also something that hopefully in years to come will continue to be lessons learned, conversations. So with that theme, I want to ask from Gayle on through, can you just give us kind of your top combination of where are we today, where do you see this intersection of health and security briefly, or the most important kind of intersection point, And then we'll go from there with some, hopefully, discussion. We don't want this to be just one by one. We want this to engage. And anybody kind of after Gayle, feel free to riff off the same question, but at least get through, I hope, what we're trying to describe today, health and security. Gayle.
Sure, thank you, and good morning, everybody. We're all slightly paranoid. We have not been to a public event yet. So if we freeze, that's the reason why. A couple of things. I think we have to define this pandemic as a security threat. If you think about it, if a group of people had upset the global economy, killed over 5 million people, destabilized every country in the world, caused massive job loss, shut down commerce, we would probably see that as a security threat. This is a virus, and so yes, it is also a global health emergency, but it is also and fundamentally a risk to security, not just national security, but in fact global security. And we're seeing many of the manifestations of that now, almost 2 years in. Where are we? I think we have made considerable progress in the last 6 to 8 months, but I think we are not where we need to be. We're particularly proud of the fact that we have dramatically ramped up vaccine availability over the months, but there is still a global gap. And the virus is moving faster than the international community is. There are a number of reasons for that we can get into. We're more fragmented than we have been historically. So I would say progress, but still very, very, very much to do. This is far from over.
Great. Gary, your thoughts, just to open up?
I would agree with that there has been progress, but the only gap that's larger than the gap between vaccine haves and have-nots is the gap between the global rhetoric and the reality. Due to the United States holding the summit in September, global leaders aligned around the WHO goals of vaccinating 40% of the population of all countries by the end of 2021 and 70% by mid-2022. But the reality is that almost all of the 92 of the poorest countries in the world are going to miss that 40% target by a huge and tragic margin. And only 5 countries in Africa are on track to make that target. And the problem isn't that there isn't supply. There's more than enough supply in the world to meet the needs of those countries, 1 billion doses to get to that 40% target. The problem is that the supply isn't getting to where it's needed most, because the high-income countries have secured more doses than they actually need. And the way to solve that problem, I think, is to redistribute those excess US and G7 doses to the lower-income countries. And even assuming boosters and vaccinations for children, we calculate that among the G7 and the US, there are about 1.3 billion excess doses. So that's the pathway, I think, to making progress going forward.
Great, thank you, Gary. Secretary Sebelius.
Well, I don't disagree with either of the prior speakers. I do think distribution is critical, getting the doses to the right places. I think that doesn't deliver the last mile. And one of the things that we're going to face in countries around the world, and we've seen a bit in the United States, frankly, but have managed to solve it, is getting shots into people's arms, which requires trained workers. It's a logistical nightmare to think about some of the countries and the infrastructure that we're going to be dealing with. So one thing is to get the vaccine supply there. The other is to really get that vaccine supply into the most rural areas and villages. We've seen it with polio. We've seen it with other issues where the kind of, frankly, health worker terrorization that we've seen in the United States, which is new to the United States, is unfortunately part of the challenges in many countries around the world, that health workers are often not seen as friendly and as supportive. So overcoming some of those barriers in countries is going to be difficult. I would say we also have finally had a really sobering lesson in talking to people about the fact that healthcare is connected to the economy. We don't have to have that lesson so much anymore. I mean, watching the economy not only of this country, but countries around the world topple because of a health pandemic is sobering, but it also brings home the message that you really can't have a safe and secure country unless you have a healthy country, unless we are resilient. And so going forward, I think we, not only in the United States, have to take those lessons very seriously. If we want to be economically prosperous, we have to be a lot healthier as a nation. And looking at any of our health measurements, we are not there. We are a long way from being there. But that lesson is sobering, and looking around the world, it's not just about the vaccine, but it's about what it is that makes nations start on a healthier path. How can we really build that resilient infrastructure in these countries? So beyond the vaccine, what are the G7 countries going to do to help build that global security infrastructure? In 2014, we launched a global security health initiative. It now has about 62 nations contributing, and part of the goal is to have trained, not only trained epidemiologists, but trained health workers who can be deployed to even the most remote regions of the world and quickly feed information and try to control and contain outbreaks as they develop. And I think rebuilding that infrastructure, doubling down on that effort, recognizing that nowhere in the world is safe unless all of us are safe. We are globally connected, we are globally put together, and we have to solve this mission globally.
Thank you. Anne?
Just reinforcing some of the themes, I think it's important to recognize where we came from. You know, in early 2020, I never would have thought that we would have multiple vaccines, multiple therapeutics, and that we would have gone from a global capacity of, you know, single digits to delivering 8 billion vaccines around the globe with the goal and intent to get 12 billion distributed around the world by the end of the year. There's nothing short of remarkable, but to the points made, there are lessons learned. I think what we've seen is how interconnected we all are globally. That's one of the biggest lessons learned from the pandemic, and to the points made, we need to reinvigorate multilateral cooperation and collaboration so that we're avoiding protectionist, nationalistic policies and policies that actually contribute to inequalities in terms of distribution and access to vaccines. And I think, you know, all of us committed, and I know all of us in the room are committed to how do we ensure equitable distribution, think about things like dose sharing and how to address some of those critical issues in terms of last mile distribution and ensuring other countries are ready, because it is a national security issue for us. It is in our collective interest to ensure that as many people are vaccinated around the globe as possible, because really that's going to prevent additional variants, and that's going to ensure that we all are safe, able to live our lives comfortably and prosper.
And we'll talk about maybe kind of how there's a balance between what feels like a moral objective, or that this is beyond just kind of feeling morally indignant about an approach or a lack of an approach to a global strategy, and kind of the national security implications, to your point, why it's incredibly prescient for everyone to focus on this. All right, so Gayle, I want to ask you, and everyone is going to have a little bit of a different theme on this, but I wanted to first ask kind of how do you ensure, especially in your leadership role currently and in the past, that we're not just focusing on this pandemic, but the next, and I'm just thinking, might not be part of the answer, but thinking about kind of fiscal preparation, government financing. All of us know it's a zero-sum game where you have to think about budgets. So maybe that's a fiscal intermediary fund or some of the vehicles that you have been really kind of behind. How do you think about that? And what are some of, if you can give us a preview of what are some ideas maybe in queue? And none of this is official, sure, but just some of what's in your head about how to prepare for the next pandemic.
And look, you always have to think about budgets. But I'm confident that the cost of preventing and preparing for the next pandemic will be less than what we are spending now. So it makes good sense to do it. There are a few things. I mean, the backdrop is that the United States has led the creation of and the expansion of a real foundation of global health support around the world. And I give a lot of credit to my colleague to the right. This has been done on a bipartisan basis for almost 20 years with continued bipartisan support, whether it is in the fight against AIDS, ending the Ebola epidemic, maternal child health, malaria, consistently. And that's a really, really important foundation and one of the ones we need to build on. What we found is we've got to walk and chew gum at the same time. Even as we deploy, we're now in the process of deploying over 1 billion vaccines around the world over the coming months. But even as we do that, get shots in arms, as the Secretary mentions, we've got to work on the preparedness, and frankly, the world is not right now prepared for the next viral threat. I was in the Obama administration in the White House for 6.5 years. During that time, and Kathleen will remember this, there were 6 viruses that rose to the level of White House attention. So what do we have to do? First, we have to look at institutions and how we modernize the institutions we have so that they are fit for purpose. That means a degree of agility. It means expertise. It means being fully financed. Second, we've got to look at norms. Are there some new norms that may be necessary? I think many were surprised at the position the President and the U.S. Trade Representative took in supporting a temporary TRIPS waiver. This is an extraordinary moment. We've got to look at extraordinary steps like that. Third is the financing. We need sustained financing to help build the capacity of all countries to prevent, detect, and respond to global health threats. There are going to be more of these. We know that. This is a quantifiable threat that scientists and other experts can measure in advance, in real time, and make projections upon. So we've got to get that financing, and we can't rely solely on our development budgets. I oversaw our development budget for some years, and this has got to come from multiple places. Lastly, we've got to think about how does the world govern itself in the face of a threat like this? There have been calls for a global health threat security council of sorts. Do we need an international body that pulls leaders together, as the President has done in September and will continue to do, so that there is a monitoring of what we're looking at, a calling out of the gaps, and the compelling of urgent action when we need it? We don't have the architecture that we need right now. We're very committed to, as I say, working in real time to stop this pandemic, but also laying the ground for the architecture that we're all going to need in this country and around the world.
Great, thank you. Gary, I want to actually, something that you brought up in a past conversation, but a little bit of a perpendicular theme around accountability. So there's many examples. We're still trying to actually understand kind of who and how and when to hold things accountable. You, as part of your leadership role currently and in the past, think about accountability probably from a number of viewpoints. Where can we put into place at some point currently and going future forward accountability for the impact that are either lack of a response or to the kind of argument that I think many of us would make, potentially you included, that we're certainly failing at least on some of our not just moral objective, but we're actually facing some of these security threats because of our lack of action. You can say it's the redistribution of doses. You can talk about, before COVID, the proliferation of pandemic organizations and planning organizations, and how still somewhat we seem like we're not necessarily meeting some of the goals that we had set out. Where does that accountability kind of lie? And how do the leaders who are getting together today, for example, the G20 countries, what is the conversation like amongst those leaders to think about accountability moving forward, 21, 22, and beyond?
It's a great question, and it is a conundrum, because if you think about it, we're over 20 months into this pandemic, and we still don't have a globally agreed, fully costed plan to end the pandemic. And worse, the international architecture, Gayle was talking about what we need. What we have now, the international response architecture, is an alphabet soup of organizations, COVAX and CEPI, the IMF, the WHO, and Gavi. And it's largely leaderless, and I'd argue it's leader-proof. And that's where the United States needs to step in and show the leadership that it's been showing, and more so. We at the COVID Collaborative, together with Duke University, will shortly be launching the Global COVID Accountability Platform, a platform, an external independent accountability hub to track commitments and to advance actionable recommendations for closing the gap between targets and action. I know that there's a move afoot led by the United States to create an accountability tracking mechanism globally. I think both of those things are good. Of course, they all beg the question, when you raise the question of accountability, it all begs the question of who's accountable.
Right.
And at the present time, as I said, there's no clear leadership, no clear ownership of the global response. So at this point, you've got to hold everybody accountable. And part of me fears that by holding everybody accountable, we end up holding no one accountable.
That would be it. Just to build on that a little bit, Secretary Sebelius, how you obviously are in touch with not just current administration leaders, some of who are on this stage, but present in many of the conversations for, I think what I would argue are at least kind of overtaking the pandemic, even in a poll done in the last 48 hours, has kind of fallen below education and a number of domestic priorities. So we're here talking about what I think is one of the most important issues and why health is a national security issue. You just articulated beautifully in your opening comments why it goes beyond even the health around how COVID-19, kind of the implications and what COVID-19 unfolded. How does this, to your point about kind of the relationship between health and the economy and this very obvious tie, what is it that we need to get through, not just to the American public, but it does feel like the world is just tired of talking about COVID. I think there's probably days where all of us are just tired of talking about the pandemic. We want it behind us. What do you think are some important lessons that you would like to impart to not just leaders who are sitting in the shoes you've sat in, governors, national leaders, but also to think about messages to the public? I feel like somehow we're losing in trying to explain this in a way that the public can understand why they should think about this, why this is top of mind, why this has everything to do with education and the economy.
Well, I think those are great global questions. I think you got to start from, I think, a view of the United States. We do a great job reacting. We don't do a great job in a proactive manner. The only time that I have seen, and at least in my years of service, a really proactive financial framework response was after 9/11, when there was an enormous effort, Congress, agencies, others, that we will never be in this situation again. A large amount of money for future opportunities to make us safer and secure, new departments created, all kinds of efforts underway, and this is just the US. But there was a very proactive effort, some of which was probably wrong-headed and wrong-targeted. But what I watched during our administration is the dollars that were put aside being spent, and Congress basically having very little interest in refunding that or supplying for the future. To basically they went to zero, and there was not a lot of effort in what was going to be the next crisis or the next issue or funding for the future. So we had a hard time getting our government officials. I think the public is interested in what's happening, mostly, understandably, in their lives, in their homes, in their schools, in their communities. To think about even the next state over often is a challenge, much less globally. Most people don't get up in the morning and say, I'm part of a global community, and I care about what's happening in Nairobi as much as I do about Nebraska. It is not the way people's psyche is put together. And so we have a real challenge, first tying health to national security, and I think we've begun to do that just by the real life efforts tying health to the economy. But then I think for the United States to be a leader, we have to start with our own ability to educate our own citizens and prepare for the next events, and I have to tell you, we are staring down some very scary situations. We don't have to wait for the next pandemic. Antimicrobial resistance is growing. It's in hospitals in every part of this country. It is a huge challenge. We don't have any investment for new antibiotics that the government has made. We don't have any bolus of money saying to these very talented scientists and innovators, you know, we need the next generation of antibiotics to deal with all of the diseases we take for granted will be solved by antibiotics. We're going to run out of antibiotics pretty quickly that can cope with infections and challenges. And the United States is at the front of that effort to burn through antibiotics because we use more than any nation on earth, and a lot of them are used in agriculture. So we have things that we know within a relatively short period of time could be a real life-threatening situation, and getting people to focus and attention and getting money set aside and getting a public-private partnership going on that sort of vein is very, very difficult. So I don't think it's all gloom and doom. I think this has to be a 9/11 moment. I think if we don't take this pandemic and say, all right, let's deal with, we should be a resilient country, which means we have to be a resilient world. We have to have resources and interface with agencies that don't work together and a global structure to deal with this. There is a global health security initiative with the G8 countries who meet on a regular basis. But again, very disconnected often even from the leadership of that country. So the framework has been started, but I think to get proactive and use this as a moment to reassess where we are, but where we need to be is just essential. If we walk away from this by just ending COVID and ending this pandemic, shame on us, because we're putting everybody at risk.
No, thank you. I think recent events have kind of made it very clear, and by recent events I mean domestic events even included, notwithstanding what's happening in the world, have made it incredibly clear that we're so ill prepared. And even the public health infrastructure investments, which I think all of us have championed over the years, we've seen those decimated in a very clear way. And I want to ask you, because we're building on this theme of preparedness, you've talked about kind of the miracle, the true miracle of vaccines, therapeutics, and that's what's available today. That's not even what's in the pipeline potentially for the next, let's call it 1 to 5 years, which is incredible to think about. But we're running into issues. Probably everybody here has been told that a package is delayed or they're going to stores with bare shelves, and then when you take that to the international experience, it is truly catastrophic for regions which depend on basic technology to sanitize water, for example, where we're literally seeing life or death moments because of supply chain issues. I know that's not your responsibility entirely, but talk about how this is a part of the conversation that doesn't come up as often as it should in COVID and national security, but I think it's very germane. So comment on how you think not just your kind of industry and partners are dealing with this, because it is critical in drugs, therapeutics, and other interventions, but also what this reflects on what we're seeing globally in other sectors as well.
Sure. Before I respond to that, I want to build on a couple of comments made by my fellow panelists. One, antimicrobial resistance. You know, our PhRMA, our member companies, and our sister associations and partners around the globe are committed to how do we better improve the market for antimicrobial resistance agents. There are a number of legislative proposals that would address some of the gaps there. You know, the challenge is we're talking about creating medicines that we hope we're never going to have to use. So that means it's, you know, not a area that's particularly attractive for drug development. And it's a very challenging area. So this is an area where public-private partnerships are essential and where we need to address the incentives here to ensure that we're going to have those agents to prepare for the next pandemic. And I think that's something that's...
Just to be clear, I wasn't laying it on the
No,
floor.
no,
I mean, I was saying it's a government failure to not have that bolus of money to say, we are the willing buyer.
Yes,
and that's essential.
And I think it is an area for public-private collaboration, and that there are issues around educating and ensuring that there isn't overprescribing, inappropriate prescribing, but I think it's a very important aspect that we need to be thinking about in terms of future pandemic preparedness. And I did just want to, Gayle had mentioned the administration's support for an IP waiver, and just want to make sure that, kind of our industry perspective is shared, and that's that we don't believe that IP is a barrier to access to vaccines around the world. We've seen an unprecedented level of partnerships, public-private, among competitors in industry to get us to the point where we are in terms of ramping up manufacturing, identifying willing partners and capable partners around the globe. But as you know, particularly with some of these vaccines that are using new technologies, it's not just, this isn't the Great British Bake Off where you're just handing over a recipe. It always offends me when people suggest that, because there's just so much more that goes into vaccine manufacturing, having the quality control procedures in place, having the expertise in terms of vaccine manufacturing, and being able to understand and have the science behind these new technology platforms. So I think we would say that we are, as an industry, doing everything we can to deliver and over-deliver, and that we're continuing to optimize manufacturing processes, combat the emerging variants, and prepare in terms of how do we develop vaccines that don't actually require injection. And those are the types of things that industry is still working on. And what we don't want to do is erode the incentives for innovation, that erode the ability to ensure that we're prepared for the next pandemic. We think public-private collaboration, US around the globe, is going to be critical to combating this crisis, and we don't feel that IP is the barrier, particularly given we're on track to deliver 12 billion doses around the globe this year alone. And sorry, on the supply chain.
You don't have to do supply chain if you don't want to. It's a good number of topics, but any comments you want to make?
Sure. I would just say on supply chain, what we've seen is the importance of having globally resilient supply chains. And what we've seen is that, again, as I mentioned at the outset, the interconnectedness of the globe, I think that's been underappreciated. And I think what it highlights is that there needs to be more investment in terms of resiliency across the public health supply chain. What we want to avoid are nationalistic policies, protectionist policies. We certainly saw early in the crisis where different countries were implementing export restrictions and controls, how that resulted in constraints across our global supply chains. So I think that's an area where the US government can lead in terms of multilateral collaboration and cooperation and modeling the behavior that we want to see there.
Great. Now, because usually these seminars and topics often end in such a kind of serious tone. This is a serious topic. We wanted to actually shine some light on some things that have been bright spots, kind of rays of optimism, certainly building from, I think, a lot of us can point to either programs in the past, anywhere from experience with the 7 to 10 viral threats that have emerged even just over the last 8 to 10 years. Also, PEPFAR, traditional programs that decades ago were non-existent but have really built a foundation. So I'm going to ask, and I see that Gayle is still here. Are you about to?
Go ahead.
Okay.
I'll talk fast and then
very your kind of bright spot in this moment. It can be as small or big as an example that you've seen firsthand in your current role or even in past roles that offers hope for how we can look, to kind of Secretary Sebelius's point, that we don't forget this and that we actually do carry some of this forward in a prospective way. Anything you can just give the audience as an example?
Yeah, I look at two things that give me hope, though I have this rule that I refuse to be anything but an optimist, because if you're a cynic, it's kind of what's the point? The first I would say is that we actually know what needs to be done. We know how to do it. Mm-hmm. We know how to share vaccines. We know how to increase production. We know how to make investments so that there's more production around the world. Shots in arms is hard. We know what we need to do to get that done. So there's a lot of hope in the knowledge. As I said, this is a quantifiable threat. Mm-hmm. It's in many ways more manageable than some of the others we face. I think the other thing is the foundation I referred to in the beginning. We are proud, for example, with the PEPFAR program, which has done extraordinary work in the fight against AIDS and in building capacity on the ground, to be able to use that platform to expand vaccine uptake so that people are being tested via PEPFAR platforms. We are delivering vaccines through those platforms. And the beauty of that, I think, in the world we live in now is also, as I said, over 20 years, we've had not just bipartisan support, but nonpartisan support. There's been absolute recognition that global public health is in our collective interest. The United States has rightly earned, I think, a lot of reputation, a lot of credit, a lot of gratitude for our leadership on global health. And my hope is certainly that we will continue to lead on that front.
Great. See, we can.
And then I'll do my.
I was just going to say, we're maximizing your attendance.
Yeah, it turns out there's a pandemic, and so they often call these urgent meetings.
It's funny how that works. Gary, your thoughts. Again, any example, I think this is a group that would appreciate just hearing you reflect, but also what gives you hope and things that have worked that, frankly, you think deserve magnification or at least attention.
No, give.
All mics are hot. That's what she's probably getting.
It was, and that was what I was going to say. What gives me hope is that America always rises to the occasion. I mean, if you look at the history of global health, whether it's polio or Ebola or HIV or now COVID, nothing of significance happens without U.S. leadership. And slowly but surely, we've seen the United States stepping forward, first with the summit, and then leading in terms of dose commitments and pledges, albeit pledged doses don't save lives, delivered doses do, and the United States has delivered only 14% of what's been pledged, so there's a long way to go. But also in terms of creating a series now of action-forcing events, with the next upcoming one being the foreign ministers meeting that Anthony Blinken will chair sometime in early December, and then another Global Leaders Summit in the first part of next year, in the first quarter of next year. Those are hopeful occasions in which the world can come together and advance this. At the risk of being the skunk at the party, though, let me add that one bright spot is what everybody's just been talking about, namely the energy around preparedness for the next pandemic. Mm-hmm. I fear, however, that there is a rush to put COVID in the rearview mirror, even while the pandemic rages in the global south. And I think that as cases decline in the United States, mm-hmm. People start talking about managing the crisis and COVID becoming endemic. And I'm reminded of something that Peter Sands, the head of the Global Fund, says, which is that epidemics are just pandemics that stop killing people in rich countries. And we have to be aware of that. You know, I understand that the administration is focused on the domestic challenge, but we can't forget what George Bush said, namely that we can't leave behind half of humanity as we seek a better future for ourselves. There are no second-class citizens in the human race, and we've got to run that race together. And I think there's a finish line, as Gayle said. We know what needs to be done. Now it just has to muster the will to do it.
No, you're not being a skunk at the party. I think that's a very smart, profound reminder of what's at stake here. Secretary Sebelius.
Well, to Gayle's point about why be a cynic, I'm a Democrat from Kansas, so I'm a constant optimist, or I wouldn't be in that situation anymore. I would say bright spots are a bit of a look back where, you know, after H1N1, we knew we didn't have enough domestic capacity for manufacturing pharmaceuticals, so we tripled it. And that has resulted in having ample capacity at this point. We knew that there is a real issue with not having enough trained epidemiologists, so CDC put together a framework where they're now trained epidemiologists all over the world in hotspots that can be deployed quickly, which is one of the reasons Ebola was contained and controlled in many countries very, very quickly, because that capacity lent itself. So the United States over and over again, you know, some in a look back, but some in a look forward, says we need to be leaders. I do think that there is a danger that people, as you said, Kavita, at the beginning, people are tired of talking about COVID, thinking about COVID, living with COVID, and that is dangerous, to Gary's point, because as long as this virus is ricocheting around, Americans better figure out that it could come back in a very different variation that may have outlived the vaccine or may be mutated in a way that is particularly dangerous. So no one is safe until we get a global handle on this virus. And hopefully, the brightest spot that I find is the enthusiasm of a lot of this next generation in the work of health, and in whether it's domestic health or global health, the issues around science, the issues. I see this incredible generation of enthusiasm and real focus of a mission-driven opportunity, and that gives me great hope for the future. These kids live, my kids and their children live in a global world. They have passports, they understand that there are no boundaries, and I think to have that generation assume leadership capacities in a way that they figure out problems on a global basis from the start will put us all in a lot better place, and that gives me great hope.
There's been a worldwide, it's something that surprised me a little bit, but also kind of building off of your giving you hope. I thought with all the kind of, you talked about the plight and kind of terrorism against healthcare workers and how we've seen public health leaders literally kind of taken down because of what they believe in. Worldwide, there's been an increase in interest in nursing and in science, and especially from women of color. I mean, you're seeing culturally just an incredible acknowledgement for just how much science has played a role. I think, Anne, to your point, you know, the true miracle. I don't think that any of us could have projected that we would see 1, 2, 3, 4, 5 when we think about COVAX vaccines. I don't think any of us could have, or WHO vaccines, we couldn't have anticipated it. So it does warm my heart that what I thought might have been the reverse trend, that people kind of backed away from these careers, they're throwing themselves into it and they see it as a ray of hope. All right, Anne, you give us some of the last word, because I know you will live up to the promise of helping us end on a bright note.
Sure. You know, I would say science. Science has been the brightest spot. The level of collaboration across the private sector and between the public sector and the private sector in the US, I think, is a model for the rest of the world. Very early in the pandemic, there were regular meetings between the private sector and public sector to talk about, okay, what are your challenges from a regulatory perspective? What can we do to help? How can we help expand manufacturing capacity while you're in the middle of research and development? The decades of infectious disease experience that our companies have invested in was really brought to bear, as was the expertise that has been built upon in the Public Health Service and among our regulators. And it's really that view that we were all in this together, that the only way we were going to combat COVID-19 was if we all came to the table and jointly problem solved. And we also saw that in terms of supply chain resiliency. Innovative biopharma, despite all the constraints that were created during the pandemic, didn't experience major disruptions in supply chains. But we did see vulnerabilities in other aspects of our public health supply chains, be it PPE, be it the localized surges in demand for ventilators and certain ICU medicines. And I think that I feel very confident that we've identified those gaps and that we need to take advantage of this point in time to ensure that we're investing for the future so that we're better prepared for the next pandemic, and that we're working with our global partners to ensure that other countries are equally prepared. And as Secretary Sebelius referenced earlier, that we're sharing data and information as the pandemics are evolving so that we're all on the same footing and prepared.
Thank you. There are a number of things we absolutely could have spent much more time on, but I can't think of a better panel to try to take something as complex as the topic of the pandemic and its implications for national security to this level. I'm hopeful that if we can reconvene in a year when hopefully we've had a little bit more experience being around humans for longer than 45 minutes, which I think is the case for all of us, we will be able to share not only more lessons, but also be able to reflect, I think, Gary, to your point, on we actually can identify who is accountable, and that there is some level of lessons that we take forward with us for our leaders nationwide and globally. So join me in thanking this excellent panel. Thank you.
And thank you, Kavita.
Thank you.
Thank you.
All right, I'm going to get my mask on. Here we go. Thank you.